May is Mental Health Awareness Month, and today we're talking about an area that often gets overlooked, infant mental health. Joining us now to explain is Association for Infant Mental Health in Hawaii Executive Director Erin Henderson Lacerdo. Aloha and good morning, Erin. Thanks for stopping by with us.
Thank you for having me.
Can you tell us a little bit about infant mental health?
Yes, of course. This is Mental Health Awareness Month, and so sometimes we tend to forget about the littlest people in our lives, and we often think about mental health as being really important for adults and for teenagers. And truly, we could start at the very beginning of life, where the first relationships are what really set up a foundation for all the things that are to come. So at the Association for Infant Mental Health, we call ourselves Aim High. We say that we like to hold the hands of those who hold the hands of babies, because really supporting the babies and the caregivers in their lives are what's really important in thinking about mental health for our youngest children.
Yeah, exactly. Well said. For people who are new to the topic, what exactly is infant and early childhood mental health?
Infant and early childhood mental health is also called IECMH for short, and it focuses on the baby, but also the relationships that are around the baby. So there's no such thing as just a baby. A baby doesn't grow up by itself. It has to be cared for by another. And as a result, we really have to be mindful of and take care of the people who are taking care of the baby. Because if the environment around the baby is unsupported, having some challenges, then that baby is going to be have a little more challenges in getting the best start at life.
Yeah, as a parent, I can testify to that. When I'm at my best, I'm a better parent, right? The more I can take care of myself, the more I can be at my best, the better it is for my kids. You mentioned support for caregivers in that vein. Can you tell us more about consultation and how it works in practice?
Absolutely. So consultation is a service that can be provided to early care and education professionals, pediatricians, home visitors, all sorts of providers who work with young children. And this consultation service is not therapy. It is prevention-based, and what it does is it helps the caregivers who are around the baby, the providers, to be able to better attune to or better respond to the babies and young children in their care. So this might look like setting up warmer ways to drop off children at a child care facility. It could also mean, how do we talk to parents about some of the challenges that are happening at home? Maybe there's a divorce happening in the family, or they're moving. Something as simple as moving could be really quite traumatic for little children. And so consultation helps us to support the caring for young children to respond to a responsive environment.
Yeah, you think about like the better outcomes, right, with all these tools for folks to have. You folks do have a forum coming up. Can you tell us about that and who can attend?
Yes, so we do have an annual forum, and this year is our fourth one. And it's entitled Mai Kinohi Mai, or Begin with the Beginning. And when we think about infant and early childhood mental health, right, it really does start in pregnancy and in utero and through the birthing period, and that whole time period in and around birth. We call this the perinatal period. And so this period is really important because this is really starting and establishing the very first relationships that babies will have. And so we are going to be having a few speakers who are very well known in terms of their work regarding the perinatal period, but also being grounded in cultural practices. So what is it that we have always done to create warm environments that babies can be welcomed into? And so we also will be featuring a panel of speakers that are local providers here, so that we can hear about the innovative practices that are happening right here in our very own state and in our communities. So we welcome anyone who you could be a parent, so please feel free if you are available, but also community members, if you are a child care provider, a teacher, a pediatrician, a therapist, we invite you to come and learn and grow and be inspired with us.
What a wonderful opportunity. Learning and growing, very important, especially as a parent or a caretaker. As we wrap up, what do you hope people get from this? What message would you like people to take from this?
Wow, there are so many messages for sure, but the most important one to me is that the first 1,000 days really are critical to the development of young children. That's when their brain is being wired for all of the relationships that are to come. And we can make a lot of changes and do a lot of things if we can support them and set them up to have the very best start in life. So those first 1,000 days are critical. Babies remember, and babies matter.
Well said, Erin. Do you folks have a website that folks can go to get more
Yes.
information?
Thank you. Our website is www.aimhigh.org, and hope to see you there.
Wonderful stuff. Mahalo, Erin, for stopping by and sharing all